morning. We are here for the Health Committee meeting, April 5th, 2022 at 9 a.m. Would you please take roll?
Barn?
Here.
Curtis?
Yes.
Awful?
Yes. All right, may I have a motion to approve the agenda? And a second? All in favor, say aye.
Aye.
Against? What you doing?
I'm not against.
It's, passed. Everyone get the claims in your email? Looked them over? May I have a, motion to approve the claims?
So moved.
Second. Okay. Would you take, pardon,
Okay.
would you take roll, please?
Barn?
Yes.
Curtis?
Yes.
Awful?
Yes.
Sure?
Yes.
I wasn't sure if you were in on this meeting.
What?
I guess you are.
Yes, he is.
Okay.
I am today.
All right, do we have any public comments today? Seeing none. We have a report from Animal Control. Jill, do you have that today?
I do.
Okay.
Okay. Okay, so we've been busy. They currently have one case open, which is a dog bite. They're still in their 10-day quarantine, so working on that one. They closed 18 cases. We had 5 dog bites. We had, 6 dogs that were running loose that got reclaimed by their owners. And then we also had 7 dogs that got placed with, rescues or shelters. We had one that went to a new shelter that we got in contact with called Recycled Rots. We had a little Rottweiler.
Oh,
Another one went to, or is going to actually today, to Paws in Chicago. They're meeting us in Monique. And then we had 2 that went to Hospice Hearts. They were kind of elderly dogs. We had 1 that went to River Valley Rescue, and we had 2 that went to It's a Pity.
So, Jill, I'm sorry to interrupt,
No,
so, do you find these yourself or the
Uh,
shelter?
the officers do most of the legwork. I did get involved this time because we had to get some dogs moved out.
Yeah.
And we weren't having any luck. So what I did was talk to, Carrie Laird and out of Kankakee County and Dr. Updike out of Ford County. And then I went on the, state website and got a list of all the licensed shelters and rescues in the state. So
That's good
we had
to
to do some
know.
additional legwork this month because we had so many and we needed to get them moved
So that's good, I'm glad to hear that you do that.
out. Oh, yeah.
Find a
Trust me,
place.
it is not taken lightly trying to get everybody placed, so. We brought in $6,930 in the month of March. Working on the animal control license still. The management committee is still working on the animal control building. The officers are working on a pit bull hoarding situation in La Hogue. It is currently being watched, and Clint, our sheriff, is also aware of that. And, we have an animal cruelty investigation that is going on outside of Narga that the Department of Ag is also involved in because there's livestock. I know that's in the works, in the process of being handled.
Okay.
And then I just wanted to say that there is a 10-day hold on cats and dogs per our ordinance. However, we have been holding them longer, trying to get them placed. Since I took over in, was it August, September, we've only had to humanely euthanize 1, and that was because he was extremely aggressive and he had bitten a child. But the rest of the dogs have all been fostered or placed with rescues, and several of those have already been adopted to families, so. By all means, we do not want to just put down a good dog, for sure.
Yeah.
But yeah, that's
All right.
busy month.
Well, thank you for your work on that.
You're
All right, now it's time for Dee Shepherd with the Health Department
Good morning.
report.
So we had a busy month getting back to normal, or as normal as we can get back to, right? So, all those things that have kind of been put on the back burner for the last couple of years during the COVID, we're starting to hit hard, which is gonna take a long time to catch up, because we still did what we had to do, during that time, but a lot of things that we could, kind of put on the back burner, got put on the back burner because, you do what you can, what you have staff to do, right? So, so we're working our way back to some semblance of normal. We're doing home visits again, especially for the lead. We're getting the XRF machine up and running. That's our machine that tests, that we shoot the walls in homes to test for lead, to make sure that they don't have lead-based paint underneath. That, will eventually chip off, especially around windows and, places where kids tend to play. So we're getting back to that kind of stuff. Obviously, our priority with that kind of thing is, if a kid tests high for lead levels, which, by the way, the state has changed. So while we're on that subject, I'll just let you know that it used to be that if a child had 10 micrograms per deciliter of lead in their blood, then we mitigated that. Now it's down to 5. So if you find it with 5, because they're finding that these children with high lead levels are the kids that tend to be hyperactive. They tend to have concentration problems and developmental delays, and a lot of times these kids who get other diagnoses really are just have lead poisoning, literally, because they're living in a home where they're breathing in lead dust.
Okay.
So those kinds of things are really important, and we got to get back to those things and getting in those homes. So that's why one of the reasons home visits is so important right now, getting back into people's homes. We are getting back into doing more and more senior home visits, so that's a really good thing, instead of doing all the teleconferencing. So we're hoping as things go on. So let me tell you a little bit about COVID. Since I've talked to you about COVID every month for 2 years now, the numbers, guess what, our new cases last week. Guess how many cases we had last week?
He says
He's
5.
close, we had 9.
Oh, wonderful.
9 cases last week. So what a blessing that is to have them finally coming down.
Well, I can't sit. It's okay, we have a 9:30 meeting. Can I sit? I can't sit in one of these chairs, it throws my neck out. Can I borrow one of these other chairs?
Sure.
Okay.
Sure
Is
you
anybody
can.
gonna sit here? Can you sit here?
Yep.
Okay, good, thank you. Sorry to interrupt.
It's okay. So, so we had 9 cases last week. The previous week we had 20. Our new cases from March were 76. We had 76 cases in March. And in February, so the month before that, we had 439. So talk about, we went from 439 in February to 76 in March. So yeah, that's a big drop off. Thank goodness. Now I know that you guys have probably been watching the area news, and over spring break, Champaign had a little up spike, which we expect, we are seeing some neighboring counties and neighboring states that are having upswings in the B2 variant. So right now, still most of ours are coming back, the Omicron, the B2 is not a new variant. I mean, people tend to think that that's a new variant. It's not. B2 is a subgroup from Omicron. Okay, so it's just a little variation of Omicron is what it is.
Yeah.
So
How
it's those
effective
people
is it?
tend to have very mild symptoms.
Wow.
Yeah. So so we'll watch that in this area, and if we see an uptick, we'll you know, start doing some more education and putting out things on our Facebook page and press releases that say, you know, it's time to start really washing your hand washing again. You might consider, if you're in a large crowd, masking up again, you know, that kind of, anything that mitigates it. But I'll be honest with you, I don't see us going back to masking anytime soon. I don't see us doing anything that restricts people's movement or businesses. I don't see that happening again. I'm not going to be doing that again, and not that we did it in the first place, but we all know that we're going to see different variants and variations of different subgroups of this virus for many years to come. It's going to become endemic. The pandemic is going to become endemic, and it's going to, you know, we're going to see different strains like we do.
They'll be paid in 2022.
You know, last week that we started doing fourth boosters for people who, you know, want those or qualify for those. I think that there are going to be people who are very cautious and want those boosters so that they keep their antibody level high, especially if they have an underlying health condition. And then we have other people who are just gonna say, you know what, I'm gonna go for natural immunity or not worry too much about it. So, and we're okay with that, but we're here to provide whatever people are comfortable with. If they want that fourth booster, absolutely come get it. We will have it here. And we do not plan, I know a lot of places are switching over and starting to bill insurances more and more for this. We're not going to charge anyone for those vaccinations for the foreseeable future at all.
Now, the variances that are gonna be coming for years, are they gonna be as strong as the very beginning was, or?
Typically, what we see is that as especially with viruses, they tend to do one of two things. Obviously, they either spread from person to person and become stronger, or as they become weaker. They become stronger when we've all heard the term survival of the fittest and how things in our environment mutate, change to survive. So once this virus starts losing hosts, then you'll see it become a little stronger, and you will see strands of that. Naturally that's going to happen, okay? But typically, what you're going to see is as it spreads from person to person, the virus becomes weaker. So every once in a while, it will be like seasonal influenza. You know, some years you don't have a lot of influenza. Some years you have bad influenza outbreaks where, you know, lots of people are sick and lots of people have influenza A or B. So it'll be like that for a while. We're going to have to adapt to that. And the best thing people can do, the absolute best thing people can do, is wash your hands and stay home if you're sick. If you're sick, stay home. Stop infecting other people. I mean, our grandparents used to say that, you know. I was a school nurse for 17 years of my public health career. We realized that people need to go to work and that they need their paychecks and that it's hard to miss work to stay home with ill kids. So, you know, it's not uncommon for parents to give their kids some Tylenol and mask everything, mask all their signs and symptoms, give them enough medicine, and then by noon it wears off and then the kid's sicker than a dog. Well, they've exposed every kid that morning that they've been around. And parents tend to do that because they need their paychecks, and we understand that. But the best thing that you can do to stop the spread of anything communicable is wash your hands and stay home if you're sick. Those are the two best things you can do, and they're just common sense, you know. So if we can get people to do those two things, that'll make a huge difference. But it's getting people to do those things, you know. Yeah.
Do you have to make an appointment to come in and get the booster shot then?
Well, you know what, we take walk-ins and we don't turn people away,
Okay,
but we prefer that you make an appointment, because if you make, and that's to your benefit, because if you
Yeah.
make an appointment, we take the appointments before we take the walk-ins.
Yeah.
So if we've got somebody there and two people walk in at 9 o'clock, we take the one who made the appointment first. And we tell the person, yes, you're welcome to stay, and we'll fit you in as soon as we can. But we will take the appointments first. So it's to your benefit to make an appointment, because you don't have to wait. Typically, appointments made at the health department, you might not, it's our goal to never have anybody have to wait more than 5 minutes.
now what if someone asks, gee, should I get the 4th shot, get another booster? What
Then-
is your answer?
Then I would say, okay, let's talk. Are you immunocompromised? How, we take a lot of factors into consideration. Someone's age, their health, whether they're gonna be traveling, there's a whole gamut of questions that we would go over with somebody to help them make an informed decision. We don't decide for them, obviously we let people make their own decisions. But we give them enough information so that they can make an informed decision. Or at least we try to. So I'll let you know where we're at as far as total cases. As of now, we've had 7,152 laboratory confirmed cases. We've had 127 deaths, and remember, I say this to you every single month. Those deaths may not have been, those are people who have died with COVID. So in other words, they died during the 10-day period after they tested positive and were still under health department mandated isolation. Okay? So 127 of those. 48.63% of the population is fully vaccinated. Hi, Chad. Our vaccine data by range, so ages 5 to 11, we have 9.83% of the kids vaccinated, so about 10%. Ages 12 to 17, 29.2%. Ages 18 to 64, 50%, 50.19% of the population is fully vaccinated. And ages 65 and older is 77.37, so that's pretty good. So we are nearing, and because now more people are not going and getting laboratory testing done. Most people are testing at home. So but people that test at home don't have to, we won't know about that at the health department unless they call us and report it. It was that we could not, for a good portion of the last 2 years, we were not able, because we are CLIA certified, we are not able to take home test results. IDPH is now telling us that we can record somebody's home test results in the system, as long as they meet certain criteria, and we can record that. People aren't calling in and telling us that they're testing positive. They're just testing positive and taking care of it themselves. I wrote for a lot of grant money for Iroquois County, and we were able to help people who were under isolation for, especially during those 10 days, when it was a 10-day isolation. Now it's a 5-day isolation, but when it was a 10-day isolation, that's a long time to ask people to stay home. So I wrote for a grant that would help get them the supplies that they needed to be able to stay home. Food, groceries, the Advil, Tylenol, toilet paper, all those things that they needed. So we still have a good portion of that, of money left to help people. So if somebody does test positive, they can give us a call and we can help them.
Good.
So that they don't have to leave their home. So that's it for COVID. Do you guys have any more COVID questions? And then if you look at your summary report of programs, you can see all the other things that we do. Under food sanitation, they did 40 inspections during the month of March. 3 re-inspections, issued 5 temporary food permits. We had 2 boil orders, several, plan submittals. And you can go on, you can see that we did 24 water samples, which was a huge increase in our water samples. It's starting to, we're getting towards spring now, so we're gonna see that increase. We had 7 new well inspections, so that was a huge jump. All those summer things are gonna start happening now. So we did 7 new well inspections, 2 non-community well surveys. We issued a permit for a sealed well, and then we did 2 sealed well inspections. We did 1 private sewage disposal inspection, issued 2 permits. We didn't do any garbage trucks this month. West Nile virus surveillance is not kicked in yet, so that's good for right now. We did 45 tobacco compliance inspections. 11 radon kits were distributed. None of them came back bad, or, you know, over 4, so that was pretty good. We investigated 2 nuisance complaints. And then for immunizations, we did 65 childhood immunizations, 7 adult immunizations, gave 1 pneumonia vaccine. Flu season typically goes through the end of April, so we can still get flu vaccines if anybody's interested in those. We still have a few. We had 4 animal bites. Of those animal bites, 3 of them were dogs that were quarantined. 1 was a cat. The cat had to be tested. It tested negative. You can see that we had a couple really odd investigations. See the brucellosis and the Candida auris. That Candida auris one was really interesting. That person had it in their blood, which is like really rare. But they are in the hospital and they're quite ill.
What is,
It's a yeast infection of the blood.
who?
And then we had a Campylobacter, which is usually found in the stools, and this Campylobacter happened to be found in someone's blood. So that was really odd. Yeah, we had some odd investigations during the month of March. We had 2 chlamydia cases, which is down, thank goodness. You can see the number of COVID cases that we investigated. We had 2 hepatitis C cases, 1 histoplasmosis case. We had a Lyme disease investigation. That person has been testing for that for quite a while, but obviously they traveled because we're not seeing too many ticks around here. We had a syphilis case that was really odd. It was confirmed, it was treated, we interviewed them. We're just hoping that this doesn't come back as one of these non-medicinal resistant cases that we're all hearing about in the news right now. But that's an ongoing investigation. We gave some TB skin tests, did some hypertension screenings, you can see that, did an international travel consultation. If you guys are traveling, if anybody's traveling internationally, this is one thing I want to point out to you. We haven't been seeing that for the last couple of years, but if someone's traveling internationally, it's a great idea to contact us. We'll do a travel consultation with them. The travel consultation literally is kind of cool. We'll tell them all about that country, about what immunizations they need to get into the country, what diseases are actively going on in that country right now. We get a report from IDPH on that country, and it tells whether there's insurrection going on, whether there's dangerous areas, parts of the country to stay away from, where the U.S. consulate is if they need help, what the weather's going to be like. It's a really cool thing to look at, to have when you're traveling someplace, and it may give you some information that you're not able to find elsewhere, because it'll tell you right up to date what diseases they're seeing. You can see that we did 11 developmental screenings. And then, of course, we talked about the lead. We did one fraternity screening. We don't do private fraternity screening, as you know. We only do that if it's court ordered. For community outreach events, we did 19 educational presentations in March, so we're getting back to doing our education stuff. CPR, we've done some CPR classes, we've done some, we're gonna be starting babysitting classes for kids who wanna babysit over the summer. All kinds of educational things going on with us. We've done 2 press releases. We did 2 new case management clients in our breast and cervical cancer program. We assessed that, we only had 4 inmates assessed at the jail this month. That's pretty good. Then you can see the school health services. We did 201 vision screenings and 232 hearing screenings this month. And we currently have, I'm skipping around, I know. If I read everything, we'd be here all day. And then, for senior services, right now we have a total of 182 Iroquois County residents who are on senior service, services. And we still have money available to help seniors. So if you know someone who's age 60 and older, who's on a fixed income and needs some help with groceries, with medical supplies, with, wheelchairs, walkers, grab bars, candles for their, showers so they don't slip and fall, anything that helps them stay in their home, and stay out of long-term care facility. That's what our goal is with this program, is to keep people in their own homes as long as they can. We have funds available to help them. I, have wrote for grant money now 2 or 3 times for that, and we've gotten it, so, we still have funds available to help people, so have them call us. There's no income eligibility requirement. It just has to be two things: a resident of Iroquois County and age 60 or older. And that's it.
It's a good program.
It's a good program. Yeah.
Yes, you were saying that you're gonna have a program for babysitting.
A babysitting class.
I saw a post on Facebook that the Park District is having something like that.
That's us.
Okay.
So we partnered with the Park District to do that.
That's what I was
It's our
wondering
staff
when you
that's giving
said
it,
that.
yeah. So what we're doing is we're going to libraries, Park Districts, some of the schools. We're doing these things all over. What we'll be doing is teaching these young girls, appropriate babysitting and some first aid. We're not CPR certifying them, but we will certainly teach them some CPR in case they have an emergency. But it's a good program to teach girls how to appropriately babysit.
Yeah.
And so, yeah, and then what we decided to do was, each girl will get a kit, like a babysitting kit that she'll be able to take with her when she babysits, or at least take home and go over and get used to. But it will, they'll know what to do in case of an emergency, or if the baby gets sick, or, whatever. So, these kits cost about $30 to $35. So we're charging that amount for the class. But we also have, some donation money and things like that we're putting toward it. So we're gonna offer some, if a child can't pay for it or can't afford it, we'll figure out a way to get it paid for.
Okay, any more questions for Dee?
Do you have any numbers on Narcan?
Narcan? No, but I can get those for you. We give out Narcan to anybody who wants it. So what people can do is they call the health department and they can ask for Narcan. We do training and education and then provide them with Narcan. All that is provided through a grant through Kankakee County, and we're a subsidiary of that grant. So we get our supplies from Kankakee County through their funding, and we can give that to people who want it.
John had a question.
It's not really a question, it's a statement.
Okay.
This is Public Health Department Week, and I think it's fitting that we should recognize the excellent service and dedication to duty that our health department has demonstrated for this county.
The last 2 years
I make a motion that we would put that in the record to commend them and recognize that.
I would second that wholeheartedly.
All in favor, say aye. Aye. Opposed?
Thank you.
Thank you so much, Dee, you and your faculty.
I have a great staff.
Yes, you do.
I can't imagine having a more caring staff who's more dedicated to the community that they live in and to their neighbors than what we have. We are so very fortunate. I do want to let you know that throughout the state of Illinois, there is a public health shortage right now, in public health workers. People have dropped off. Lots of public health departments lost over 50% of their staff during the pandemic because it became too overwhelming. We didn't lose anyone. We had 2 people retire. We didn't lose anybody. No one quit. They worked 18-hour days sometimes, literally. I mean, there were days where we were here at 6, 7 in the morning and didn't leave till 11 o'clock at night. And that went on for months and months and months, and that included Saturdays and Sundays. We worked every holiday and every weekend for a year and a half straight. We took Christmas Day off, that was it. And actually, a couple of us took call on Christmas Day. They are fabulous, and these are you cannot imagine a more kind or caring staff who's more dedicated to their own community. They really are.
Really in the trenches.
Thank you.
All right, do we have any old business? New business? I have a motion to adjourn.
Second.
All in favor, say aye.
Aye.
Opposed? Meeting is adjourned.